What does CPR stands for? Option A, cardiac pressure resuscitation. Option B, cardiopulmonary resuscitation. Option C, cardiac pulmonary recovery. Option D, cardiac pulse restart. The correct answer is option B, cardiopulmonary resuscitation. CPR stands for cardiopulmonary resuscitation, a life-saving technique used during cardiac arrest. CPR stands for cardiopulmonary resuscitation, a life-saving technique used during cardiac arrest. CPR stands for cardiopulmonary resuscitation. What is the main purpose of CPR? Option A, to start the heart, to keep blood and oxygen circulating. Option C, to treat heart diseases. Option D, to cool the body. The correct answer is option B, to keep blood and oxygen circulating. CPR keeps oxygenated blood flowing to vital organs until normal heart function returns. Until the person shows life, trained help arrives, or you are physically unable to continue. Main purpose of CPR is to keep blood and oxygen circulating. When should you start CPR? Option A, when the person is unresponsive and not breathing normally. Option B, when the person has chest pain. Option C, after checking pulse for 1 minute. Option D, only after AED arrives. Automated external defibrillator. Begin CPR immediately if there is no normal breathing or response. When should start the CPR? When the person is unresponsive and not breathing. What is the first step in CPR? Option A, check pulse. Option B, give rescue breaths. Option C, ensure the scene is safe. Option D, starts chest compression. The correct answer is option C, ensure the scene is safe. Always check that it is safe for you to help before approaching the victim. The first step in CPR is ensure the scene is safe. What is the correct emergency number in the US? Option A, 101. Option B, 999. Option C, 911. Option D, 112. The correct answer is option C, 911. Connects you to emergency medical services in the United States. The correct answer is option C, 911. Connects you emergency medical services in US. What should you do after confirming the person is unresponsive? What should you do after confirming the person is unresponsive? Option A, give water. Option B, call for help. Option C, leave them alone. Option D, start breathing check only. The correct answer is option B, call for help. Activate emergency response immediately. What are the two main components of CPR? Option A, chest compressions and rescue breaths. Option A, AED and breathing. Option C, chest rub and breaths. Option D, rescue breaths only. The correct answer is option A. These maintain circulation and oxygen supply. What is the rate of compressions in adult CPR? Option A, 60 to 80 compressions per minute. Option B, 80 to 100 compressions per minute. Option C, 100 to 120 compressions per minute. Option D, 120 to 150 compressions per minute. The correct answer is option C, 100 to 120 compressions per minute. Effective compression should be 100 to 120 per minute. The rate of compressions in adult CPR is option C, 100 to 120 compressions per minute. How long should you check for breathing? Option A, 2 seconds. Option B, 5 seconds. Option C, 10 seconds. Option D, 20 seconds. The correct answer is option C, 10 seconds. Spend no more than 10 seconds checking breathing before starting CPR. How long should you check for breathing? Option C, 10 seconds. More than 10 seconds checking breathing before starting CPR should not follow. If the victim is breathing normally, what should you do? Option A, start CPR. Option B, put in recovery position. Option C, give chest compression. Option D, leave immediately. The correct answer is option B, put in recovery position. Keep airway open and monitor breathing in the recovery position. If the victim is breathing normally, put the patient in recovery position. Keep airway open and monitor breathing in recovery position. What does the C in CAB stands for? Option A, check. Option B, compression. Option C, circulate. Option D, cuff. Option A, check. Option B, compress. Option C, circulate. Option D, cuff. The correct answer is option B. CAB stands for compressions airway breathing. CAB stands for compression airway breathing. What is the universal sign of choking? Option A, clutching the throat. Option B, pointing to mouth. Option C, holding chest. Option D, coughing. The correct answer is option A, clutching the throat. A choking person usually holds their throat. Universal sign of choking is option A, clutching the throat. What should you do if a choking person can still cough? Option A, start CPR. Option B, encourage them to cough. Option C, give back blows immediately. Option D, do abdominal thrust. Correct answer is option B, encourage them to cough. If they can cough or speak, let them try to clear the airway themselves. Encourage them to cough. If they can cough or sleep, let them try to clear the airway themselves. CPR is most effective when started within how many minutes? Option A, 1 minute. Option B, 2 minutes. Option C, 5 minutes. Option D, 10 minutes. The correct answer is option B, 2 minutes. Every minute of delay reduces survival chances by about 10%. CPR is more effective when started within 2 minutes. Every minute of delay reduces survival chance by about 10%. Who can perform CPR? Option A, only doctors. Option B, only nurses. Option C, anyone trained or untrained. Option D, paramedics only. The correct answer is option C, anyone trained or untrained. Even untrained bystanders can perform hands-only CPR. Even untrained bystanders can perform hands-only CPR. What is the recommended hand placement for chest compression? Option A, upper chest. Option B, lower half of sternum. Option C, left side of chest. Option D, abdomen. The correct answer is option B, lower half of sternum. Placing hands correctly ensures effective compressions and prevent injuries. Placing hands correctly ensures effective compressions and prevent injuries. How many rescue breaths should you give after 30 compressions? Option A 1, option B 2, option C 3, option D 4. The correct answer is option B 2. Standard CPR ratio is 30 compressions and 2 breaths. How many rescue breaths should you give after 30 compressions? Option B 2. How long should each rescue breath last? Option A 1 second, option B 3 seconds, option C 5 seconds, option D 10 seconds. The correct answer is option 1 second. Option A. Each breath should make the chest visibly rise and last about 1 second. Each breath should make the chest visibly rise and last about 1 second. What should you do if the chest doesn't rise during a rescue breath? Option A. Try a deeper breath. Option B. Reposition the head and try again. Option C. Stop CPR. Option D. Blow harder. The correct answer is option B. Reposition the head and try again. Head tilt chin lift can help reopen a blocked airway. When should you stop CPR? Option A. When the person revives. Option B. After 2 minutes. Option C. After 5 minutes. Option D. When you are tired. The correct answer is option A. When the person revives. Continue until the person shows life, trained help arrives, or you are physically unable to continue. How deep should chest compressions for an adult? Option B 1 inch, option B 1.5 inches, option C at least 2 inches, option D 3 inches. The correct answer is option C at least 2 inches. Adequate depth helps generate enough pressure to circulate blood effectively. At least 2 inches is the deep should follow for chest compressions for an adult. Adequate depth helps generate enough pressure to circulate blood effectively. What is the correct hand position for adult compressions? What is the correct hand position for adult compressions? Option A on the lower half of the sternum. Option B on the upper chest. Option C over the heart. Option D on the abdomen. The correct answer is option A on the lower half of the sternum. This maximizes blood flow and minimizes injury. On the lower half of the sternum is the correct hand position for adult compressions. How many compressions per cycle in adult CPR? How many compressions per cycle in adult CPR? Option A 15, option B 20, option C 30, option D 50. The correct answer is option C 30. Standard CPR uses 30 compressions followed by 2 breaths. Standard CPR uses 30 compressions followed by 2 breaths. The compressions per cycle in adult CPR is 30 compressions. What is the ideal compression rate? Option A 60 compressions per minute. Option B 80 to 100 compressions per minute. Option C 100 to 120 compressions per minute. Option D 120 to 140 compressions per minute. The correct answer is option C 100 to 120 compressions per minute to provide optimal blood circulation. 100 to 120 compressions per minute to provide optimal blood circulation. It is the ideal compression rate. Should you allow full chest recoil between compressions? Option A is, option B no. Should you allow full chest recoil between compressions? The correct answer is option A, yes. Letting the chest fully recoil improves blood return to the heart. Letting the chest fully recoil improves blood return to the heart. What is the correct ratio of compressions to breath in adult CPR? What is the correct ratio of compressions to breath in adult CPR? Option A 15 is to 2, option B 30 is to 2, option C 20 is to 2, option D 25 is to 2. The correct answer is option B 30 is to 2. 30 compressions to 2 breaths is the standard for adults. 30 compression to 2 breaths is the standard for adults. How should you position the victim's head for rescue breaths? How should you position the victim's head for rescue breaths? Option A neutral, option B slightly bent forward, option C tilted back with chin lift, option D tilted sideways. The correct answer is option C tilted back with chin lift. Head tilt chin lift opens the airway for effective breaths. Head tilt chin lifts open the airway for effective breaths. If only one rescuer is present, what type of CPR is recommended for adults? If only one rescuer is present, what type of CPR is recommended for adults? Option A hands only CPR, option B full CPR with breaths, option C AED only, option D back blows. The correct answer is option A. Hand only CPR is effective and easier for a single rescuer. If only one rescuer is present, use hand only CPR which is effective for single rescuer. How should you check responsiveness? Option A shake the person strongly. Option B tap shoulder and shout. Option C check pulse only. Option D call 911 first. How should you check responsiveness? The correct answer is option B tap shoulder and shout. Gentle tapping and calling their name averts injury. Gentle tapping and calling their name averts injury. If an adult is drowning, what is the first step? If an adult is drowning, what is the first step? Option A chest compressions. Option B rescue breaths. Option C call EMS first. Option D give water. The correct answer is option B rescue breaths. Drowning victims often need oxygen first. Give 2 rescue breaths before compression. Drowning victims often need oxygen first. Give 2 rescue breaths before compression. Should you move a victim to perform CPR? Option A yes always. Option B only if the scene is unsafe. Option C no never. Option D only if another rescuer is present. The correct answer is option B only if the scene is unsafe. Move only if the environment poses danger. Move only if the environment poses danger during CPR. How often should you switch rescuer during CPR if there are two? How often should you switch rescuers during CPR if there are two? Option A every 1 minute. Option B every 2 minutes. Option C every 5 minutes. Option D never. The correct answer is option B every 2 minutes. Switching every 2 minutes prevents fatigue and maintains effective compressions. Switching every 2 minutes prevents fatigue and maintains effective compressions. What should you do if the victim vomits during CPR? What should you do if the victim vomits during CPR? Option A stop CPR. Option B roll to side and clear airway. Option C ignore it. Option D give more breaths. The correct answer is option B roll to side and clear airway. Clear the airway prevents aspiration while continuing CPR. Roll the patient to side and clear airway, and clearing the airway prevents aspiration while continuing CPR. Can CPR be performed through clotting? Can CPR be performed through clotting? Option A is, option B no. The correct answer is option A is. Compressions are effective through clots. Remove only thick layers if needed. Compressions are effective through clots. Remove only thick layers if needed. What is the first step after calling 911? What is the first step after calling 911? Option A start chest compressions. Option B give rescue breath. Option C find AED. Option D check pulse. Option A start chest compressions is the correct answer. Immediate compression save lives. AED can be attached when available. The first step after calling 911 is start chest compressions. It saves life. AED can be attached when available. How do you know CPR is effective? How do you know CPR is effective? Option A, chest rises with compressions. Option B, victim comes or moves. Option C, AED is attached. Option D, pulse is strong immediately. The correct answer is option B, victim cuffs or moves. Signs of life or effective chest movement indicate adequate CPR. Signs of life or effective chest movement indicate adequate CPR. How should adult CPR be performed if you are untrained? Option A, hands only compressions. Option B, only breaths. Option C, wait for EMS. Option D, alternate 10 compressions and 2 breaths. How should you perform adult CPR if you are untrained? Correct answer is hands only compressions. Hands only CPR is simple and life saving for untrained rescuers. Hands only CPR is simple and life saving for untrained rescuers. What should you do if the victim has a pacemaker? What should you do if the victim has a pacemaker? Option A, avoid compressions. Option B, place hands slightly above device. Option C, only give rescue breathing. Option C, wait for EMS. The correct answer is option B, place hands slightly above device. CPR is safe, avoid direct pressure on the pacemaker. CPR is safe, avoid direct pressure on the pacemaker. How should you perform CPR on a victim with a severe chest injury? How should you perform CPR on a victim with a severe chest injury? Option A, skip compressions. Option B, compress gently, still at correct depth. Option C, only breaths. Option D, wait for help. The correct answer is compress gently, still at correct depth. Compress gently, life saving takes priority over possible injury. Compress gently, still at correct depth. Compress gently, life saving takes priority CPR. What is the first step in the CAB sequence? Option A, airway. Option B, breathing. Option C, compressions. Option D, defibrillation. The correct answer is the first step in the CAB sequence is option C, compressions. C for compressions comes first in the current CPR guidelines. C for compressions comes first in the current CPR guidelines. What is the compression depth for a child? What is the compression depth for a child? Option A, 1 inch. Option B, about 2 inches. Option C, 3 inches. Option D, 4 inches. The correct answer is option B, about 2 inches, slightly less than adults due to smaller chest size. The compression depth for child is about 2 inches, slightly less than adults due to smaller chest size. What is the compression depth for an infant? Option A, 0.5 inches. Option B, 1 inch. Option C, about 1.5 inches. Option D, 2 inches. The correct answer is option C, about 1.5 inches. Use 2 fingers for infant to avoid injury. Compression depth for an infant is option C, about 1.5 inches. Use 2 fingers for infant to avoid injuries. What is the compression to breath ratio for a single rescuer child CPR? Option A, 15 is to 2. Option B, 30 is to 2. Option C, 20 is to 2. Option D, 10 is to 2. Option A, 15 is to 2. Option B, 30 is to 2. Option C, 20 is to 2. Option D, 10 is to 2. The correct answer is option B, 30 is to 2. Single rescuer follows adult ratio 30 compressions, 2 breaths. What is the compression to breath ratio for 2 rescuers in child CPR? What is the compression to breath ratio 2 rescuers in child CPR? Option A, 30 is to 2. Option B, 15 is to 2. Option C, 20 is to 2. Option D, 10 is to 2. The correct answer is option B, 15:2. Two rescuers can provide more frequent breaths, 15 compressions, 2 breaths. Two rescuer can provide more frequent breaths, that is 15 compressions, 2 breaths. How do you check responsiveness in an infant? How do you check responsiveness in an infant? Option A, shake gently. Option B, tap soles of feet and call name. Option C, squeeze arm. Option D, check pulse only. The correct answer is option B, tap soles of feet and call name. Avoid shaking. Gently tapping is safe. So we can check responsiveness in infant through tap soles of feet and call name. And we should avoid shaking. Where should you place hands for child chest compression? Option A, both hands on chest. Option B, one hand. Option C, two hand. Option D, over abdomen. Where should you place hands for child chest compression? The correct answer is option A, both hands on chest. One or two hands depending on the size ensure proper depth. One or two hands depending on the size ensure proper depth. Where should you place fingers for infant chest compression? Option A, lower half of sternum using two fingers. Option B, palm of hand. Option C, entire chest. Option D, abdomen. Where should you place fingers for infant chest compression? Is lower half of sternum using two fingers. Two fingers allow safe, effective compressions. Two fingers allow safe, effective compressions. Should you cover the infant nose and mouth during rescue breaths? Should you cover the infant nose and mouth during rescue breaths? Option A, only mouth. Option B, both nose and mouth. Option C, only nose. Option D, only mouth if older than 1 year. The correct answer is option B, only nose and mouth. Infant breaths requiring sealing both nose and mouth. Infant breaths require sealing both nose and mouth. How do you give rescue breaths to a child? How do you give rescue breaths to a child? Option A, blow rapidly. Option B, give two slow breaths of approximately 1 second each. Option C, give 5 short breaths. Option D, only one long breath. The correct answer is option C, give two slow breaths of approximately 1 second each. Each breath should make the chest rise. Each breath should make the chest rise. Okay. When should you call EMS for a child? Option A, before starting CPR. Option B, after 2 minutes of CPR. Option C, after the 10 compressions. Option D, never. When should you call EMS for a child? The correct answer is after 2 minutes of CPR. Give 2 minutes of CPR first. If alone, then call EMS. Emergency medical system or service.